everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to go over 3 mnemonics to help you remember isolation precautions in preparation for the NCLEX exam. Because for NCLEX you need to know what diseases are included in either contact, droplet, or airborne precautions, and you also need to know that special PPE that you need to wear. So these mnemonics are unique, and I created them so whenever you're looking at the mnemonic, you're going to know if it's airborne, contact, or droplet, what diseases are included in them, and what is the special PPE that you wear for each precaution. Now, in the next video, I'm going to go over in depth standard precautions and transmission-based precautions, which are isolation precautions. And I'm going to go over the highlights that you need to know for the NCLEX exam. So be sure to check out that video next. And as always, in the YouTube description below or at the end of this video, you can access the quiz that will test you on isolation precautions. So let's get started. Okay, first let's start out talking about airborne precautions. What is included in this category? Okay, you have chickenpox, which is also called varicella, disseminated herpes zoster, which disseminated is like a widespread outbreak throughout the body, and it's also known as shingles. You have measles and tuberculosis. Now here, if you notice the red little asterisks, chickenpox and disseminated herpes zoster, these patients are going to be in contact precautions as well. So you'll have them both in airborne and contact precautions. So you'll have to wear the gloves and the gown at all times along with that N95 mask. So with airborne, you have to wear the N95 mask at all times and follow your standard precautions, which includes the hand hygiene and the other types of PPE that you'll need to wear based on the type of care you'll be providing to that patient, which we're going to go in depth in the next video. Okay, so how are you going to remember all these diseases, the type of PPE you need to wear? Okay, remember this mnemonic. Airborne chicken number 95 dissected her tubby mealworm. And either the word or the first letters of the word is going to tell you the disease, what type of PPE you need to wear, or if it's airborne or contact. So let's look at it. We have airborne. We know that this is airborne precautions. This mnemonic belongs to that. Chicken, that goes with chicken pox or disease. We have number 95. The N in number in 95 tells you you're going to have to wear your N95 mask. Dissected her, that represents disseminated herpes zoster, and tubby represents tuberculosis, and mealworm represents measles. Now let's look at droplet precautions. What diseases are included in this? And as you can tell, a lot of them. Okay, so what are they? We have whooping cough, also called pertussis, the adenovirus, streptococcal pharyngitis, scarlet fever, pneumonia, flu, also called influenza, the parvovirus B19, also called fifth disease, the pneumonic plague, diphtheria, the pharyngeal kind. In contact, which we'll go over next, it's the skin infection of diphtheria, so don't get those two confused. This is the pharyngeal kind. German measles, which is also called rubella, meningococcal diseases like sepsis, pneumonia, and meningitis, mycoplasma pneumonia, epiglottis, mumps, and the rhinovirus. So what are some things you need to take into consideration with this? Okay, the ones that had the brown asterisks by them, such as the adenovirus and the flu emphysema, these patients will be in droplet and contact precautions. So remember that. How I like to remember with the adenovirus, you're going to add another precaution on. And just with the flu, I just remember that because that's just a nasty thing to have, and you just want to glove up and gown up and make sure you don't get it. Okay, so what do you wear with this? What kind of special PPE do you wear at all times with this patient? A mask, like a surgical mask. It's different than that N95 mask that you wore in airborne. The N95 mask stops the smallest little droplets, like in Airborne, the droplet nuclei, from you breathing them in. The surgical mask with Droplet, the particles are a little bit bigger, and the surgical mask is strong enough to stop those. And you're going to follow those standard precautions as well. So what's the mnemonic to help you remember all these diseases and what you're going to wear, and if it's droplet contact or airborne? Okay, here's the mnemonic. Whose adjustable droplet mask stops scary pneumatic fluid parasites plaguing distinguished German men? My epic mums, Rhonda. So each word, each part of the word will correlate with the disease, or it'll tell you if it's droplet or mask. So let's dissect it and go over it. Okay, whose? That is for whooping cough. Adjustable, the AD, to help you remember adenovirus. And then droplet is the precaution we're talking about. The mask is what you're going to have to wear. Stop is the streptococcal pharyngitis. Scary is for scarlet fever. Pneumatic is for pneumonia. Fluid is for flu, aka influenza. Parasites is for the parvo B19 disease. Plaguing is for the mnemonic plague. So I wanted to do plaguing instead of another word that looks like mnemonic, because plaguing, pneumatic, plague, and pneumonia go hand in hand. They are sort of similar. So just remember the word plague and you know it's the mnemonic plague. Distinguish for diphtheria. German for German measles, which is also called rubella. And then men for the meningococcal diseases. And to help you remember the diseases that go along with that, remember sepsis, pneumonia, and meningitis. Okay, meningitis is the M in the word men. The E in sepsis is for the E in men, and then the N in pneumonia is for the N in men. So that will help you remember the three. It's 3 letters. You have 3 things that go along with it. And then MY is for the mycoplasma pneumonia. EPIC is for epiglottitis. MUMS is for mumps. And then Rhonda is for the rhinovirus. Now let's look at our last precaution, contact. What is included in this section? Okay, you have medication-resistant organisms like MRSA, VRE, extended spectrum beta lactamase, and Klebsiella pneumoniae. Next, you have patients who have diarrhea from an unknown origin, or like a GI infection with a C. diff, the norovirus, or the rotavirus, and hepatitis A. But there's a catch with hepatitis A. If the patient is incontinent of stool or diapered, you'll need to have them in contact, because hepatitis A is spread through feces, and if you get that on you, you could contract hepatitis A. Okay, next, wound infections with excessive drainage or streptococci, eye infections like conjunctivitis, pulmonary infections like RSV or parainfluenza, and skin infections, which are impetigo, lice, scabies, herpes simplex, chickenpox, which remember is also airborne, herpes zoster, and the disseminated herpes zoster, the widespread, is airborne as well, and the cutaneous diphtheria. Now, with contact precautions, your special PPE, you wear at all times, are gloves and a gown, and you'll follow standard precautions with these patients. Okay, so here, let's go over this mnemonic to help you remember this material. Remember, don medical gloves / gown with every contact precaution session. Okay, so Dawn tells us diarrhea, unknown origin, or GI infections like the C. diff, the norovirus, or the rotavirus. Medical is the M for medication-resistant organisms like the MRSA, the VRE, Klebsiella. Gloves / gown is what we're going to wear with this patient at all times. With is the wound, excessive wound drainage infections, or with the streptococci. Every reminds us of eye infections like conjunctivitis. Contact is the mnemonic that this deals with. It's a contact precaution. And precaution stands for, the P stands for the pulmonary infections like RSV or parainfluenza. And then the S is for our skin infections, the impetigo, the lice, the scabies, herpes simplex. Okay, so that wraps up this lecture on mnemonics on how to remember isolation precautions. Thank you so much for watching. Don't forget to take the free quiz and to subscribe to our channel for more videos.